open patient. Its purpose is to make the patient clean and feel comfortable, to increase the sense of well-being, to promote muscular relaxation, and relieve the feeling of fatigue. So we have equipment needed for this procedure. I have a wash basin here with warm water, then a pair of gloves, soap, hygiene supplies. I have here lotion for moisturizing, baby powder, deodorant, alcohol. Then I have a bath towel, bath blanket, patient gown. I also have here a bed pan or urinal, then a hamper for soiled linens. So, let's start. First thing to do is assess your client's tolerance for this activity. Check if she can perform self-care. Then, adjust the room temperature and ventilation. It should be warm room to prevent the client from chilling. Then, provide patient privacy by drawing the windows and closing the doors. Then, explain to them the procedure of what we are going to do to gain their cooperation during performing. So, hello, I'm Mary Claire Apgao, your student midwife for today. May I know your name and your birthday? So now, Miss Red Bear, I'm going to assess you from bed bath. Is that okay for you? This is for you to feel comfortable. Okay? Then, offer bedpan or urinal. So, I will insert a bedpan under your legs before we start the bed bath. Are you done, Mom? Okay. Remove the bedpan and wash your hands for infection control. So now, adjust the bed from comfortable working height position to prevent muscle strain to the healthcare provider. Then, remove the top linen by placing a bath blanket before removing the top sheet. This is to provide warmth and privacy to the patient. And now, remove the patient gown. If the patient has an IV, remove the gown from arm without an IV. Then, don't disconnect the tubing. If a patient has injured, remove the gown first to the part of injured. To the part where it was injured. Okay, Ms. Red Bear, I will be going to remove your gown now for we to proceed to the procedure. Okay. So, since my client doesn't have an IV or injured, hospital setting and position your client into the semi-faller's position. If you want to remove the pillow, then remove. But in this procedure, I don't want to remove the pillow to support the client into the back. Okay, ma'am? You can position, I will now position you into the semi-faller's position. Just like this. I will provide, so this pillow will provide support to the back of the client. of the water or if it is cold. So, ma'am, can you check if it is okay for you? Okay, thank you. Then, make a mat of a washcloth. Water because soap will irritate the eyes of the patient. So, ma'am, can I clean your eyes now? Start from the inner canthus to the outer canthus. Then, use the other portion of the wash towel on the other side, for the other side. From inner canthus to outer canthus. Next, wash client's face, ears, and neck, as if the patient wants the plain water or water with soap. So, Mr. Redbear, do you want to wash your face with soap or without soap? So, our patient wants a water with soap. So, met the towel. Starting from the other side of the face, then the other side, then the ears, and the neck. Then place a bath towel under the arm of the patient. Okay? Then, clean the arm, including the underarm, using a soap with water. So now, I will clean the arm of the patient using a long firm strokes from the distal to proximal. Long firm strokes stimulate blood circulation. So I will start the arm away from me or on the other side. So here. Underarm. Then rinse with plain water. Meet that towel. Then pat and dry the arm using a bath towel. And now, repeat the procedure on the other side of the arm near you with the same procedure using a long form stroke. And now, fold bath towel in half. And wash the hands of the client chest and the abdomen of the client using a long form strokes. Dry the chest and the abdomen of the client. After that, replace the water for sanitary purpose. Then, turn the client on the other side to clean her back. Put a back blanket into the back of the patient, then clean using a long form strokes, starting from the hairline up to buttocks into the anus. If unable, put the patient into the supine position and cover with butt blanket. Perineum area in the front. If the patient can able to clean herself, put a basin and the soap under the reach of the patient. For her to complete the bath, this is to provide patient privacy and comfort if she don't want to clean her perineum area by others. Wash hands, then assess your client to wear a clean gowns for her to be comfortable. And if she decides to put a powder or a lotion, you can assess her. So ma, you can wear your gown for you to be comfortable. Wash your hands for infection control, then document all the procedure we've done in this demo.